failure is very common in Jamaica. We expect at least 400 new patients for every million population will develop renal failure in Jamaica. Renal failure is the same thing as kidney failure. Kidney failure means that your two kidneys are not working. What the kidneys do is remove toxins and excess fluid from your body. So if the kidneys are not working, the toxins will build up and the fluid will build up. So you'll find that you might be swollen, and the toxins, when they build up, make you feel ill until it stops your heart from working. There's stage 1 to stage 5, with stage 5 being the worst. And usually at stage 5, you will need some form of kidney replacement treatment, like dialysis. Dialysis is one form of kidney replacement treatment.
The whole process is to remove waste and extra fluid from the patient. So the blood is going down and the bath is coming up. And waste is removed through the process of osmosis and diffusion. Also, fluid is taken away. So the waste products are taken away and the blood is then returned to the patient.
It costs about $27,000 US per machine. So it's a very sophisticated piece of equipment, as you could imagine, because the whole process of taking the blood and returning the blood safely to the patient is not as easy as it seems. There are two forms of dialysis. There's hemodialysis and there's peritoneal dialysis. Presently, it will cost on average about $1.2 million per year to treat a patient with kidney replacement treatment, meaning either one of the dialysis process.
I've been coming to the Cornwall Regional Hospital, getting treatment here for 12 years now, every Monday and Thursday.
When the dialysis came into being here, I was in that batch of first patient that experienced dialysis right here.
Well, it's a long time ago. It's 1997. That's when the unit first started, but it was opened officially, I think, April 30th, 1998. We determined that the West needed to do kidney replacement treatment because the patients had to go to Kingston, but most of the patients just died because there was no availability of dialysis at this part of the island.
I never knew that it was so hard when I was traveling to town until I started doing it down here. It takes me 4 hours to get to you, like me start out. You have to get up every Monday, every Thursday at church, catch a bus to go to Kingston. It was real hard.
We came up with the idea that we should approach a private company to partner with the ministry to set up a dialysis unit, and Scotia Foundation was kind enough to partner with us. So some of the technical staff that need to go overseas, they helped to send some of those technical staff to be trained also. And over the years, that has been great. What you're seeing presently is hemodialysis. So Cornwall Regional also has a peritoneal dialysis program, and we have about 26 patients on peritoneal dialysis. And we have approximately 121 patients on hemodialysis.
It slowed me down a whole lot, but like working and normal functioning in your body, you have problem.
It means difficulty with the job because of the severity of my situation, because it was chronic renal failure, what do you call end stage. I had to resort to early retirement.
Renal failure has always been around, but it is very common, and we need to do something about it. Of course, the way forward is to prevent it from happening, and the way to prevent it is to control hypertension and diabetes, because those are the most common causes of renal failure.
The lifestyle that you live, it can affect you. Avoid doing things what you know will hurt you.
Visit your doctor and have regular updates on your system. Be very cautious of your diet. Things that you know that would enhance the failure, you would leave that alone.
As it goes along, cleaning is taking place. All the waste is being removed. By the time the blood reaches the end, it should be fully cleaned.
The Teller was brought to you by Scotiabank Group.